So firstly on the vaccine passport or immunity passport idea, that's certainly something we're looking at very very carefully and closely. For the time being, and we will be shortly reiterating that on our Smart Traveller website. I've been discussing with my colleagues in Department of Foreign Affairs about the wording of that this morning. We were asked to do that by the Foreign Minister. Is that there's no change. If people have been vaccinated or not, they will be having 14 days quarantine for the time being. And we should remember that although vaccine has been rolled out in a number of countries, I think tomorrow will be the first person in the UK will be getting their second dose of vaccine. And we know that the Pfizer vaccine, even though it's very effective, that maximum effectiveness doesn't kick in until a week after the second vaccine, which is essentially a month after the first vaccine. So we have some time to consider these matters, but for the moment, vaccination will not be an alternative to 14-day quarantine, and those decisions will have to be thought through carefully over the coming months as to how that will be handled. And the second one about mass crowd events, I presume you're referring to the Sydney cricket test match? Yes. So I'll admit I'm a cricket tragic. I've been to many Sydney Test matches. The most memorable one, I'll give a shout out to my 91-year-old mother-in-law and my 86-year-old father. We had a wonderful day at the cricket, and I know it's a great thing for Sydney to have that event. We know that outdoor entertainment or that is in a seated venue is much safer than indoor gatherings, and that was stressed by New South Wales Health today, and I agree with that. I must say that I know that there are very good COVID-safe plans that have been reinforced with New South Wales Health, the SCG, I'm sure, as well as Cricket Australia, and that will be able to be looked at in coming days. There's crowd restrictions, for example, masks will be available, etc. But I would just reiterate with my family, I wouldn't be taking them to this particular cricket because of the vulnerability, and so there is a risk. It needs to be outweighed with the benefits, of course. The other thing I would say is that the start date's the 7th of January, and 9 days is very long in COVID time. So let's see what happens in Sydney in the next week. Any follow-up questions? Tamsin first.
I was just wondering how confident you were that the way that other states have dealt with the Sydney outbreak, that managed to stop the virus getting in. Do you have any concerns that we haven't detected the virus in other cities that's come from the Sydney cluster?
Well, I'd reiterate the advice we've been giving from the beginning. If people have even the mildest symptoms that might be related to COVID, and everyone knows what they are now, to please get tested, come forward and be tested. The testing rates in other states and territories outside of New South Wales are pretty low at the moment, but please just consider getting tested if you